start with head circumference, which is the third measure of growth. So at birth, if you don't know what the measurement was, the average is 35 centimeters. So it's usually 0.4 to 0.8 inches or 1 to 2 centimeters larger than the chest circumference at birth. And the head circumference reflects the status of brain growth and might be the first indicator of disturbances of the skull. That's why it should be routinely measured in the first 3 years of life. So how do we measure the head circumference? So using your tape measure, make sure it's relatively new. Naman yung tipong ilang taon lang nasa inyo yung tape measure kasi nagbabago din. Diba, na-affect din eh. Nagiging flimsy or nagle-lengthen din siya. So, you locate the occipital part of the head and then the supraorbital ridge. So you start at the supraorbital ridge, going around the occipital prominence at the back of the head, locating the maximal prominence, as you can see in the photo. So hindi nyo pwedeng ilulup. Ha? So right, yung tape measure, hawak mo pa rin, what's gagawin mo? No, hindi siya accurate. Talaga, one point, other point, paikot. Okay? You can do it up to 3 times and then get the average, lalo na kung malikot yung patient ninyo. Okay, so the table shows the expected growth in head circumference per month. So in the first 3 months, it's 2 centimeter. 4 to 6 months, 1 centimeter. 7 to 12 months, 0.5. And then 1 to 3 years old, 0.25 centimeters. And then 4 to 6-year-old, 1 centimeter per year. Okay, practice. AA is a 4-month-old who came in for a well baby visit, born via NST with an APGAR score of 8.9 and a birth weight of 2,500 grams and a birth length of 50 centimeters. So, given the average head circumference in the table earlier, what is the expected head circumference of AA during the visit? May answer na. Okay na? Do you have an answer? 42. Anyone who got another answer? Same answers? Same answers? How about the others? Same? Okay. So yes, it is 42 centimeters. Because, di ba, if you don't know what the measurement was at the time of the visit, you use the average, which is 35. And the expected increase from birth to 4 months is 7. Okay, so 35 plus 7, 42. Okay? Hindi na. Per month na siya. Ayun, nakalagay sa numbers, per month. So per month. At the first month, plus 2 cm. Second month, plus 2 cm again. Or the third month, plus 2 per month. Hindi siya katulad ng length na kailangan mong i-divide. Kaya I need you to remember that. Kasi confusing, diba? Length, i-divide sa head circumference, length. Okay? Alright. Head circumference is clear for everybody? Yes. So we move to chest circumference. So this is not routinely taken, but of course, at the time of delivery, kasama to sa mini-measure. So, it actually is useful if you do take it every time the child visits because you can compare with the head circumference. May discrepancy ba din ba? Pareho na sila? Is this something that I should again be worried about? So normally, diba, the head circumference should be greater than the chest circumference by 2 centimeters from birth up to the 5th month of life. from 6 months to 2 years old, the head circumference is already equal to your chest circumference. And then 2 years and above, head circumference is lesser than your chest circumference because the organs in the chest grow more rapidly than the brain by that time, during the toddler years. So you measure at the level of the nipple line during the phase between inspiration and expiration. Okay, so medyo mahirap siyang hulihin. Diba? That's why, don't rely on one measurement. If you need to take it 3 times again and get the average, that is fine. Okay? Okay, BMI, already practiced that. It was discussed also with you during the session. So it is another measure of growth that indirectly measures body fat. So it is considered as a valid predictor of adiposity and the best clinical standard for defining obesity. So you use BMI for children who are 2 years and above. Okay? So we compute by getting the weight in kilograms. If you don't have the weight in kilograms, you convert, and the height in meters squared. So the BMI table, which is flashed before you, it gives the height and the weight. So you just need to get the intercept of the two to get the computed value. So an example here is the height is the height is 88 centimeters with a weight of 11.6. So the computed BMI is 15. So anasan siya sa gitna. Okay? Kung wala kayong, kung kumbaga may table kayong available, easier versus computer. Okay, and then we plot it. We plot it with the z-scores given by the WHO. So again, what is the normal value? BMI that falls between +1 and below -1 is normal. If it's above +1, it's possible risk of overweight. Above +2 is overweight. Above +3 is obese. And then -2, below -2 and -3 is wasted. And below -3, severely wasted. Okay, exercise. So LW, 7 years old, weight of 23, and height of 123 centimeters. What is the BMI? Anyone? 8.2. Anyone who got a different answer? For everybody? Yes. Okay. So you just you just put in the data, 23, and then you change the centimeter to meters, and then do it square. So you get the value of 15.23 kilograms per meter square. Okay. Next measurement is the we're good with BMI? Yes. We can move to mid-upper arm circumference? Yes. So, shown before you is how we measure the mid-upper arm circumference or the MUAC, which is a measurement of thinness naman. Kung BMI is for obesity, mid-upper arm circumference is for thinness. So, what are the steps? So, number 1, at the top, locate. Of course, remove clothing. Ang hassle, di ba? Kung akit-akit mo pa yung sleeve niya, gano'n. So, remove the clothing and then shall expose the arm. Locate. Number 2, locate the tip of the shoulder and the tip of the elbow. Okay, you have to locate the tip of the shoulder and then the tip of the elbow. By number 4, place a measuring tape over these two sides and get the midpoint. Mark the midpoint. Then the tape is used to measure the circumference of the upper arm at the midpoint that you located. Okay, so you just don't put it anywhere. That's why you have to locate tip of shoulder, tip of elbow, find the middle, sa big upper arm, diba? And that's where you measure. Okay? And the reading is made to the nearest 0.1 centimeter. So there's really a different tape measure for the mid-upper arm circumference. We don't often use the ones that we have. So meron yan kasi may indicators din siya. So this is an example of that measuring tape or tool that we use to get the mid-upper arm circumference because it also gives us already the interpretation of the measurement. So, it's often done in the community. Kasi, kumbaga, lalo na kung malayo sila sa hospitals or sa mga physicians, it's the healthcare workers who do this. Okay? So, This one is suitable for measuring a child's middle upper arm circumference with a range up to 26.5 centimeters, as you can see at the end of the tape. So graduated with 1 millimeter precision with thicker line at 21 centimeter. So the front side, which is color-coded, on top, you will see that the red from 0 to 11.5, yellow 11.5 to 12, napaka-narrow, di ba, ng yellow. Tapos ang laki ng green, 12.5 to 26.5. The reverse side, which is at the bottom, just shows you the instructions in case you forget. How do I measure the mid-upper arm circumference? And what do the colors of the tape mean? So green, normal. Yellow, it's already moderate acute malnutrition. And then red is severe acute malnutrition. So that's the meaning of the colors there. So green is good, yellow not, red is bad. Okay? So normal green, yellow moderate, red severe. Now we move to triceps skin fold thickness. So this one is another index of nutritional status of an individual, and it can be correlated with the body fat content. So the site of measurement is determined by having the individual bend the right arm at the right angle using a tape at the site halfway between the tip of the olecranon and the acromial process on the posterior aspect of the arm. Okay, with the arm in a relaxed position, the triceps skin fold is lifted by about 1 centimeter. Kita nyo in this picture, parang kinurok. Okay, so you lift that. And then, using the thumb and the index finger, and you have a caliper so that you can grasp the wrist skin fold. So the average of 2 readings to the nearest millimeter with the gauge at the eye level is recommended. Okay. So again, we don't routinely do this, but it's nice to know. Okay? Still good? Okay, so matapos naman na tayo sa measurements, we will be moving to growth charts. So as I mentioned in the previous lecture, the most powerful tool in growth assessment is your growth chart, because these tools contribute to forming an overall clinical impression for the child being measured. It's not a diagnostic instrument. Okay? So growth charts consist of a series of percentile curves that illustrate the distribution of selected body measurements in children. Pediatric growth charts have been used by different healthcare professionals like your pediatricians, nurses, and also parents can also use this to track the growth of their children. So it determines the child's growth percentiles, the weight, and the length or the height, and should be plotted on the appropriate growth chart at each well-child visit as indicated. So I think you notice naman, di ba? The Z-scores pa lang. Yung birth to 5 years, birth to 2 years. So you have to check that before you plot, and then you interpret. Mali yung interpretation kasi maling age. So the evaluation of child growth trajectories and the interventions designed to improve child health are highly dependent on the growth charts used. So the US CDC and the WHO in May 2000 and April 2006, respectively, they released new growth charts to replace the very old 1977 NCHS reference. Okay. So the WHO curves are growth standards that describe how children grow under optimal conditions. So normal development, normal growth development siya. While your CBC curves are mostly growth references that describe how children grew in a specific time and place. That's why we use the WHO growth chart form. Okay? And then these are the examples of your growth reference data or the WHO growth charts that we use. And these are the different growth charts available which are standardized. That's why before you plot, always check that you have the correct growth chart. Kahit yung color. Mamaya girl pala, pinaplot na sa pang-lalaki. Kaya lalaki pala, pinaplot na sa pang-babae. So always check. So this is an example of a growth chart for weight for age for girls. Pink. So clue na siya. So mas maganda color na maintain na growth charts. And then you take note of the age, birth at 0 to 2 years old. So in the vertical or in the y-axis is the weight in kilograms. And then on the x-axis or the horizontal is the age in months. So the numbers on the right side represent, the colored ones represent the z-scores, which has a corresponding interpretation. And this is the table that will show you the interpretation for the growth charts. Okay? So once you plot, you just need to correlate with this table. And then there are specialized growth charts. Okay? And these are developed for US children with various conditions like Turner syndrome, or they may have been also in terms for birth weight, for gestational ages, okay, for trisomy 21 or Down syndrome, for achondroplasia, and then for your Williams syndrome as well. Okay. And then this one is used for in terms of the small for gestational age or in terms for preterm babies. Okay? So those special growth charts, we use that talaga very specific kasi hindi nyo pwedeng i-plot knowing that the child has Down syndrome, and I plot it on the WHO growth chart which is of the typically growing kids. Kasi we know already, like for Down syndrome, Williams syndrome, any child with a genetic condition, iba yung trajectory nila. So, hindi nyo pwedeng i-define with the standardized tools. Kaya nga tayo may dinevelop na special growth charts. Okay? So, however, yung concern dyan, their sample size is quite small and the nutritional status was not assessed. So, the AAP still recommended the use of the WHO and CDC growth charts so that you can relate to the parents what is the expected growth at his or her own potential, even if it's below the normal growth curves. So, you explain as well that it's acceptable for their child to grow at slower rates if they are consistently tracking along a satisfactory curve. Hindi siya bababa, di ba, yung trajectory, or hindi siya steady in a line. So, dapat paakyat din. So, kahit below, negative 2 siya, pero paakyat pa rin yung trajectory niya. We can explain na this is based on their genetic condition, growth potential of their children. Okay. Now, for premature infants, we actually need to correct for their gestational age. So we don't just ask when were they born. You also ask when was the mother expecting to give birth, and then you minus that para makita nyo kung talagang pinanganak siya sa ganitong age, ano na yung expected age niya by this time. Okay? So, sometimes kasi, akala natin, preterm, ang baba, pero yung pala, pag kinorek nyo, appropriate pa rin pala, pasok pa dun sa age niya at this time. Now, we also have to check again abnormal patterns of growth. So, it can be slowed or accelerated by a variety of conditions. It can be caused by a variety of factors as well, like congenital conditions, systemic diseases, endocrine disorders, nutritional deficiencies, psychosocial conditions, or familial disorders. Changes in growth may be the first sign of a pathologic condition, like inflammatory bowel disease, hypercortisolism, and thyroid dysfunction. So, following conditions are examples of abnormal patterns of growth. You have your poor weight gain, your obesity, short or tall stature, and of course the head circumference or the head size, microcephaly, and macrocephaly. And this table, which is also in Nelson, shows the common causes of decreased growth and short stature. So again, di ba, last week we had a lecture on length and height. So not all decreased growth is abnormal. That's why you have to know the normal patterns. So variations of growth, as mentioned before, include their constitutional growth delay and familial short stature. And then, also those who are tall or accelerated growth may be a variation of normal, or there may be an unexpected increase in growth. So you have to identify if there is an underlying condition. So this is another table that you will also see in your book, Nelson's, that will also discuss or describe what are the other causes of increased growth or tall stature in different kids. So genetic conditions such as your Sotos, Klinefelter, and Marfan syndrome are associated with tall statures. Okay, so measuring growth is done, but we also have the different vital signs. So, aside from getting the weight, the height, and then the head circumference, the chest circumference, we also get the blood pressure, the respiratory rate, and the heart rate at every visit for our patients. So, the 2017 AAP guidelines recommends that children 3 years and above, so 3 years and above naman. Kasi we have to recognize also na hindi lahat ng cough kasha sa mga bata. Diba? Yung smallest, ganyan. Hindi rin kasha sa neonates, medyo malaki. So kung hindi maganda yung fit ng cough, hindi rin maganda yung kuha ninyo of the blood pressure. It will also affect. So that's why you make sure you use the appropriate size cuff for the patient. Okay, so 3 years and above, you should measure their blood pressure. So unless the child has risk factors such as obesity, chronic kidney disease, or diabetes, it should be checked at every healthcare encounter. If there are no comorbidities, you can do it every year. So annually lang siya sinecheck as part of the preventive guidelines. Okay. Now, as mentioned already, appropriate use of the cuff. Blood pressure, as you can see in the tape, hindi nga lang siya clear, very sorry, that it changes or it varies depending on the age of the child. So, kunwari 90-60, depende sa age yan. Should I guess that already hypertensive? 80/50, is that already hypotensive? So, it depends. Kasi kung 2 years old, 80/50, very acceptable pa siya. Pero kung 16 years old na siya, tas 80/50, that's something that we should work out. Okay? So again, this is the age-specific percentile of blood pressure measurements for boys naman. And then this one is the normal variation for heart rate or normal values. So you can see, again, different for every age group. Newborns mabilis, pero kita nyo up to 190 possible. Pero already by 12 years old, bumaba na siya. Highest possible is 110. So if tachycardia, again, look into the possibility of any underlying medical conditions. And again, the normal respiratory rates for children, from currently na siya. So again, you can see that mas mabilis ang breathing in the first year of life, but then it becomes slower as you get older. Kaya kung mabilis yung breathing in the high 20s na siya when you're already in the teens, it may be a clue of an underlying lung disease. Or, pag mababa naman din yung respiratory rate, baka nagpa-fatigue na siya. That's why you need to know the normal values per age kasi it is different for each. And that is the end for growth. Do you need a break? Wow. Parang 30 minutes pa lang tayo nag-lecture break na. Okay, I'll give you 5 minutes and then we'll proceed with development.